So, for those of you who are new, I'm Alan Leshner, and I have the pleasure of chairing this committee on medication treatment for opioid use disorder. We are in the third day of our meeting, but the second day of what has been so far a phenomenally successful and helpful workshop. So don't feel any pressure, people, this morning. But the people who have come before you have been fabulous. Since some of you don't look familiar, two things. One, see those lights? Those lights can be the kiss of death. Green means talk, yellow means 2 minutes, red means stop talking. And people have been extremely obedient and therefore don't feel any pressure again, but we expect it. Secondly, let me take a minute and we'll just run around our committee so people know who they are in case they didn't. I'll ask them to say their name and their affiliation, starting with David. Push the button.
Hi, I'm Dave Vlahov, and I'm from Yale University.
Hi, I'm Yasmin Hurd. I'm from the Icahn School of Medicine at Mount Sinai.
Scott Steiger, University of California, San Francisco.
Chinazo Cunningham, Albert Einstein College of Medicine and Montefiore Medical Center.
Laura Lander, West Virginia University.
David Patterson Silverwolf, Washington University in St. Louis.
Kathleen Carroll, Yale University.
Walter Ginter, National Alliance of Methadone Advocates, Mars Project.
Colleen Berry, Johns Hopkins University.
Tracy Green, Boston University and Brown University.
Huda Akil, University of Michigan.
Sean Ross, American Nurses Association.
And I'm still Alan Leshner. I am what's known as productively unemployed, but I used to be the CEO of AAAS and the publisher of Science, the journal Science, and before that, in an earlier life, I was the director of the National Institute on Drug Abuse. So before we get started this morning, I am obligated, since this is a public meeting, to read the following. This is an open, on-the-record information gathering session. As part of the process, the committee collects information and materials to consider and discuss as it makes its findings, conclusions, and recommendations. Please be mindful that the committee has made no conclusions about anything yet. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the National Academies of Sciences, Engineering, and Medicine, or anything else except them. Information about the study process. For those who aren't familiar with the committee process, this is the first of 2 planned in-person committee meetings based on a review of the literature and input from the workshop, which I'll repeat has been terrific. The committee will draft a report with findings and conclusions to be released in March 2019. Before the draft report is released to the public, it will go through a rigorous review by experts who are anonymous to the committee, and the committee must respond to the review in excruciating detail with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it's considered an official Academy's report. We do very much appreciate the opportunity to hear from people. Our task is extremely straightforward and is spelled out in the bullets I think everybody has seen, but because of the academies and the academy process, everything we say has to be based on data and based on evidence. And so for us, having you all come is extremely helpful as we try to flesh this out. Excuse me. So the process we've been using, I will ask you to use the microphones because we're being recorded, and to speak into the microphone so we can actually hear you. There's a little button. If you'd like, you may use the podium when it's your turn to speak. And we'll go through the panels, and then at the end, the committee will ask questions. We have not been opening it up to the audience because the committee doesn't seem to run out of questions in the time allotted, but we're trying to be extremely precise with time because it's a very tight time schedule. In case you're wondering what will happen next, after we finish the workshop this morning, the committee will go into closed session where we'll actually begin to frame our findings and conclusions, and then we'll have one more meeting, and then we'll have a phone meeting, and then it'll go into review. So with that, David Patterson Silverwolf is going to moderate this session, and in which case I will alert you he has a hook. So if the red light goes on and you don't stop soon, it will come out. Go ahead, David.